Hello, my name is Grin, and this is my beard. And the crumb I'm pulling out of my beard today is going to be about healthcare. Healthcare in Japan, and suddenly there are CEOs falling dead. Uh, Healthcare CEOs falling dead. Oops. Well, maybe, maybe, just maybe, it wouldn't be happening if they weren't terrible people that only care about money. And maybe, just maybe, healthcare shouldn't be something that, you know, is a money making venture. Just my opinion. But here in Japan, we have socialized healthcare. So, what can I say about that? Well, if you're coming to Japan and you want to live in Japan or stay in Japan for even a small amount of time, you should definitely sign up for the healthcare in Japan, the socialized healthcare. Don't wait either, because if you wait, there's a possibility that when you do decide to join, you might end up having to pay for the times or the previous years that you weren't in the healthcare system. So they're not going to charge you for time that you weren't in Japan, but if you were in Japan and you weren't part of the socialized healthcare system, and then later, a couple years later, you decide to join it, they might charge you for the time that you've been in Japan too. Now, even then, it's worth it, totally worth it. For one thing, healthcare isn't as expensive here in Japan. Like I've heard horror stories where people go to the hospital for something, and I don't know, they get some aspirin and maybe a bandage or something like that, and the charge is like $1,000 or some ridiculous number, like $100 for a band-aid or some garbage like that. It's ridiculous. That is ridiculous. You're not going to find that kind of thing here in Japan. If you go to the hospital and you get a band-aid, it's going to cost you the same as a band-aid costs. Now, and then the time that you take usually is no more than uh, uh, 30 dollars, about 3,000 yen, in which case the national health care will pay for 75% of that, usually around 75% of that. So you only pay 20 to 25% of the charges that you are charged, and those charges are going to be way less than you're going to find in the United States. You're not going to go see a specialist and get charged, $20,000 for a 1 hour consultation. That's just not going to happen. Nobody's worth that much money. It doesn't matter. You're not. That's just not going to happen. Um, but even if something like that were to happen, so you're going to end up paying, what is that? So it's $20,000. So you're going to end up paying $5,000. Yeah, even that's just like ridiculous. I don't think they can even charge you that. Like I think there's a limit. Like you can only, if you spend more out of your own pocket. Yeah, there's a limit. If you spend more out of your own pocket than like uh if you spend, I think it's like $5,000 out of your own pocket in a year for health insurance, for health medical issues, you can get anything over that back at the end of the year. So as long as you keep your receipts and stuff like that, if you spent that much money on healthcare, on your whatever hospital visits that you have, you can get that money back. So there's a limit here in Japan of how much you will need to pay over a year. It's never going to be one of those things where you have to go to a loan shark to pay, or take money out, or even take a loan out to pay, or even, have them come at you with bills. You're not going to have that. It's just not going to happen. There's no way. You're never going to be charged so much that you can't, pay it. Even if you have like an MRI, I've had many MRIs and whatnot, and never has it ever been more than like $50 for, lots of different tests. I, I once swallowed uh, was it Sumayoji, a toothpick. I swallowed a toothpick. We have these like this food that there's a toothpick in it, and usually you take the toothpick out. And this one I ate, and the toothpick was taken out, but part of it had broken off inside the food. And then I was chewing it. I was not chewing it properly. I swallowed that sucker, and I felt it going down too. Oh man! But I went to the hospital for that. I had stomach problems for, I don't know, a week or something like that. After that, just pain in my gut. They never did find the toothpick, but I had they put a tube down my throat to look for it. They did like a CT scan of my stomach trying to look for it and whatnot. They never found it, but I had a lot of different tests, and um, it didn't cost that much. It wasn't. It was probably at the most san yen, $30 after all the tests and whatnot. And that's going to the emergency care, not like it's like in the states. I hear if you go to like urgent care or emergency care, the costs are just prohibitive. They're just insane. I can't imagine that. Can you imagine being in an ambulance going, do I just die or do I let them, work on, try to save my life? Because I don't know if I can afford it, and it might be better off to die. I just can't imagine somebody having to make that kind of a thought inside of their head. It's just that is inhumane, in my opinion. That's just inhumane to have a system that makes that kind of thought process a reality. No, don't do that. The only thought process you should have is uh, uh, how can I get better? And if I mean the worst that you should have is uh, you know thinking about your family and your friends that you might leave behind if you did die. That's that's what you should be worrying about, not thinking about the bills you're going to leave behind to your family if you die. That's why it blows my mind. One of the bigger reasons why I never went back to the United States. Now, when I was living with my mom, I had insurance because she had insurance, and I was just a dependent of her, so I was under her insurance. If I ever had any problems, and I had a lot of problems, I had asthma, I had all kinds of different sicknesses and illnesses, and if we didn't have that insurance, yeah, my mom would not have been able to support us kids at all. So, thank God she had that insurance because of her jobs, because of her work, but why should that even be necessary? Like here in Japan, kids, they're covered under the it doesn't matter if they're under the age of 18, they're covered under the national health care, and they don't have to pay like they only have to pay like 10%. Parents only have to pay like 10%. Uh, and medicine is free. They don't Kids do not pay for medicine. If a child needs medicine, it's covered. That's all paid for by the the uh, insurance by the national health insurance. I mean, there's no CEO going, how can we make more money by doing things that make us more money? There's none of that. It's just, how can we prevent these healthcare providers from overcharging for things so that we don't have to pay so much money, but they're not worried about making profits or anything like that. Making profits on somebody's life, on somebody's health is inhumane. Simple as that. So yeah, that's my thoughts on that. So anyone who is in a CEO position where they have to decide how to cut funding or save money or gain money for profits based on people's health and well-being, they're bad people. It just straight up, you're a bad person. You're a terrible, money-making, grubbing, slimy, slug crawling, terrible person. Sayaku da ne. You're terrible. I would never be a CEO of a health or wellness company. That's no. No. Should not be making money on people's health and welfare. It's not I'm not saying that they shouldn't be making money specifically. They obviously, doctors and whatnot, need to get paid, but they don't need to have 20 yachts, and they don't need to have a million different hedge funds. That's ridiculous, in my opinion. In my opinion. So yeah, any one person or any one entity making a huge amount of profit off of the health and welfare of lots of people, that's, in my opinion, evil. So I don't have any empathy for a a CEO who gets killed. However, it's still bad. Killing is not okay. Killing someone, why would you do that? Why? Why? That is the worst thing you can do. That is way worse. Just way worse. People are so important. Living life is so important. Why would you? I don't know. Anyways, bad is bad. Even if no, even if everybody's doing it, bad is bad. Even if everybody's doing it, and good is good. Even if nobody is doing it. It's just kind of the way it is. Now, back to healthcare. I've gone on my rant about CEOs and healthcare and garbage, evil companies. Now, healthcare in Japan does have a problem. Mental health is not something that is really covered in Japan. Now, if you want to get diagnosed or want to see a psychologist, that is covered under the national health insurance. But if you want to get prescriptions, or if you want to get some sort of help for that, or you want some sort of medication, you want some sort of uh, something to help you change your situation, that is not covered. See, psychologists, they study mental things. They don't prescribe treatment. If you want treatment, you have to go to a psychiatrist. And psychiatry in Japan is not covered under most situations, not covered under the healthcare system in Japan. And it's even considered bad. I mean, think of it this way: if let's say there was somebody who was a doctor, and they're a really good doctor, but they got diagnosed with ASD, or something like that, then they would probably lose their job. Oh, you have ASD, you can't do this anymore. Even if they've been doing it for 20 years and their record is immaculate, just the fact that they got diagnosed with ASD would make them ineligible to do that job. If companies are looking for someone and they see, oh, this person has been diagnosed with ASD, they won't hire them. They won't hire them. If let's say you have any kind of, even if you have what is it called, uh, ADHD. If you have ADHD, if you advertise that, if you tell your company, oh, I have ADHD, they're very likely to just be like, oh, well, thanks for your work, we don't need you anymore. They'll find some way to get rid of you. You can't let you can't let that out. You can't let people know about that, because people don't want Businesses don't want people who have mental instability. I mean, obviously there's a reason for that. You have a mental instability that can be a liability. However, in my opinion, it's having a mental instability uh, shouldn't be any worse than having a physical disability. So if this job requires you to have a hand and you don't have a hand, they should be able to fire you or not hire you at all. It's like, unless you have some way to, let's say, make a hand so that you can do the job. You've designed a hand that allows you to do this job that you couldn't do without a hand. Well, this should be the same for mental states too. So I've got ADHD, but I have medicine that allows me to function as if I don't have ADHD. That should be fine. That kind of thing should be fine. And I mean, for the most part, it is, but not not everything. There's still a huge stigma around people who have any kind of uh, mental abnormalities, disabilities, challenges, whatever it is, whatever you want to call it, however you want to name it, anything that has to do with mental disorders or abnormalities is considered no go territory. You don't want to hire people with that. That's kind of just the way it is here in Japan. And it shouldn't be, but it is. So that's my take on healthcare. And and I really wish it would change. Like, okay, here's an example. Uh, uh, okay, my family are from two different cultures. Basically, my wife is Japanese. I'm American, and we clash a lot. And it would be nice to have some sort of help, some sort of psychological help to, help us come together and compromise on certain things. But asking for that help or trying to find that help looks bad, and it could cause problems with my work. It could cause problems with my wife's work. So we basically don't have that. We have to deal with it ourselves. We really have to, if we have issues uh, or discrepancies or differences in opinion, we have no choice but to work it out ourselves. And that can be a huge stumbling block for foreigners trying or wanting to have a relationship with someone who's Japanese. There's no help for it. Now, if we went to the States, there'd be no stigma and there'd be no problem. We'd be able to find help, no problem, and there wouldn't be anyone saying, "Oh, well, because you're having a family crisis, that's going to look bad on our company, and we're going to let you go for that." I mean, is that discrimination? Maybe there are some rules against that, but they can find a way to get around that, and they do. So but in the States, it's more strict on not being able to do that. However, healthcare in the States is less attractive. Yeah, I wouldn't want to. I don't. I wouldn't want to pay any healthcare company in the United States for any kind of coverage of health in the United States. My stepfather, he had what is it? He had what is it called? Uh, yeah, he had a type of cancer. I can't even think of it right now. It's a male type of cancer. Why can't I think? Anyways, he had to go get this kind of like invasive kind of radiotherapy and chemotherapy when there was a much more effective and less invasive therapy that was available, but it wasn't covered under his insurance. And so he didn't get it. And it turns out that he had a really bad reaction to the treatment that they had prescribed to him because it was available to him under his health care. and it killed him. It just two treatments of this chemotherapy, radiation therapy, and something that shouldn't have killed him, something that 90% of people don't die from, ended up killing him. Bothers me a lot. Bothers me a lot. And I'll have to live with that for the rest of my life. Uh, and it's, I even talked to my stepfather about it. Hey, there's this treatment that you can do, and he's like, no, no, I can only do what my insurance allows me to do. It's like, you're not even gonna listen to me? Nope, can't do it. Can't afford it. That hurts. Feels bad. Feels bad. I was able to go visit him uh, about a week before he passed away. So at least I have that, and my cat Sugar. Same time, they passed away pretty close to each other. Last time I went there was the last time I was able to see both of them. Although my cat was really old. He was like 20 something years old. His name was Sugar. Yeah, he was a Siamese cat, kind of like Sugar. Anyways, healthcare. That's the thing here in Japan versus in the United States. I don't have to worry about that here in Japan. I've got coverage and I'm paying. If you come to Japan, join the national healthcare system, whatever. If they say, do you want to or do you not want to? Don't. Don't. There's no do you not want to. It's just do it. It might cost you some money. Like they'll take money out of your paycheck, but not the first year. The first year will be very inexpensive because they charge you based on how much money you made the previous year. So if you make zero money the previous year in Japan, your first set of payments are going to be very low. And then the next set of payments are going to be based on what you actually earn. So if you're only going to be here for like a year, definitely get into the healthcare system because it will save your butt. All right. And you'll be amazed at how easy it is to just go to any doctor and get any help uh, anytime you need it without worrying about, oh my God, am I going to be able to pay for this? Yeah, that kind of thing just doesn't happen. The most I've ever had to pay for going to the doctor, I think, was like 7,000 yen, which is about $70. And I had some major consultations, tests, and all that kind of stuff, MRI, all that kind of stuff. And so yeah, it was pretty expensive. It was also an all day type of thing, but that was one time only, and it was something that it was like not normal. It wasn't a normal thing. I was having a problem that they couldn't figure out. So I had to go through a battery of tests to figure it out. Turned out that it was most likely a bad tooth. And when I got my tooth fixed, all those problems went away. So yeah. All right. So that's that. Oh, also, dental care is also covered under the national health insurance in Japan. So yeah, I feel so sorry for my family living in the States and anyone living in the United States just because of the terrible healthcare system that, I mean, you've got some of the most advanced uh, procedures and doctors and whatnot in the States, and they will all just consulting with them will put you in poverty or, yeah, put you in debt. It's ridiculous. Shouldn't be that way. Shouldn't be that way. All right, well, that's what I wanted to say. It's what was in my beard, and it's a big, sticky, nasty thing that's stuck in my beard, but I got it out. So, thank you. Have a good one. Oh, Merry Christmas if I don't see you or if you don't watch my videos before Christmas. Merry Christmas. Bye now.